Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Do you have a Medicare Part B or Medicare Advantage plan? If you do, then you are eligible for a free yearly Medicare Wellness Visit. Joining us to talk about this is Kaitlyn Bertrand. She's a physician assistant. Thanks so much for joining us.
Thanks for having me.
So, what is this Medicare Wellness Visit?
Well, a Medicare Wellness Visit is an annual health assessment that we complete yearly, and it's to develop or update that personalized care plan to help prevent diseases or disabilities based on a patient's current health and risk factors.
This has to do with healthy aging.
That's correct. Yeah, we're all about healthy aging for the life.
And so, who is eligible to get this?
Any patients with Medicare Part B or Medicare Advantage are eligible.
And how often can you get it?
Medicare Wellness Visits are offered yearly for our eligible patients.
So what happens if something changes though? Let's say your medication changes, or let's say you have some major event during the year. Let's say like you have a heart attack or a stroke. Can you go back and update this wellness visit?
Well, the wellness visit is once per year, but we encourage all patients anytime they have any major medical changes to go ahead and follow up with your primary care doctor's office so that we can get, you the correct care that you need and make sure that your medical chart is accurate.
And how does the patient prepare for this visit?
Before the visit, the patient is going to receive a series of questionnaires that they can answer either over the phone with one of our clinical staff members, or if they sign up through MyScripps, they can do that at myscripps.org. It's also going to be helpful to have an updated list of any medications you're taking or supplements and any outside vaccines you've had at your pharmacy.
And so what actually happens during this annual wellness visit?
During the annual wellness visit, you're going to have your height, weight, and blood pressure measured. We're also going to review your medical history and your family history. It's also an opportunity to update your current list of care providers, which are like any specialists, like a cardiologist for any heart conditions that you're seeing, if you have a dermatologist, and to make sure we have your correct primary care doctor on file. We're also going to do some screening tests and questionnaires to see if you're at risk for developing any memory difficulties or behavioral changes. We'll check to see if there's any mobility problems, to see if you're at higher risk for falling. And this is also an opportunity to review any advanced care planning, which is like your end of life choices.
And these can be real tough conversations to have, right?
Yeah, they are hard topics, but at the end of life, if you're incapable of making those decisions, maybe you've had a major medical problem like a heart attack or a stroke, and you're incapable of making that decision for yourself, it's important to have that conversation of health ahead of time while you're still healthy.
And you also talk about depression and isolation with these patients, correct?
Exactly. We find that a lot of our elderly population struggle with depression and isolation, especially after our pandemic.
Or maybe someone in their family has also passed away.
Yeah, definitely.
And these, as I said, these are hard conversations to be had, but they are conversations that really need to take place.
Exactly. And that's why we really encourage patients to come in for these Medicare wellness visits, because it offers us an opportunity to have those hard conversations.
And once again, to emphasize, this does not cost the patient anything.
Exactly. This is a free service offered by Medicare.
So how does this Medicare wellness visit differ from an annual physical exam?
Well, during a Medicare wellness visit, there's no head-to-toe physical exam component, but this is an opportunity for us to review your medical chart in its entirety, as well as to update those preventative care screenings that you may be due for.
So you're not going to draw blood. You're not going to send stuff to the lab for testing.
Any topics that are